think this is it.
Welcome, everybody. This is our second installment of the Tech Doc series. And I'm Dave Cameron, the Chief Medical Officer of Hint Connect.
I'm Brad Brown, Medical Director of Hint Health. I'm excited for this one. This is going to be fun. We were just talking about this as a gray area. There's no right or wrong answer. So I'm excited to hear what you have to say, Dr. Dave, as well as some of the crowd.
So just want to give a quick plug while people are coming in. The Hint Summit we've got a date. It's going to be in San Diego, sunny San Diego, this September 20th to the 23rd. Can't wait to see you there. And there are pre-sales going on right now. It's going to be now through March. And make sure you get signed up so you get the discount that goes along with that pre-sale.
Which actually, I just thought of something. If anyone wants to bring their families to that, starting in October, the San Diego Zoo is free for kids starting in October, for the month of October. So you could just make it a long thing. So that's a good reason to go to the Hint Summit, and then stay a little bit extra with your family. How about that? Sorry, right. Way off topic. That is way off topic, and not a plug for the San Diego Zoo either. But,
yeah. Well, good. Well, let's start. And it's going to be the two of us. This is going to be a conversation. Feel free to throw in questions. Comments. We'd love to see what's going on. We're both direct primary care doctors that interact with technology, and we're doing our best to keep up with the new stuff that's coming out. So we're just gonna share about what our experiences have been. And so, would you mind, Dr. Brad? Would you mind just giving us a brief definition of what is artificial intelligence?
Oh my gosh, what is artificial intelligence? What isn't it, right? I mean, it's man builds machine takes over the world, right? That's kind of what all the movies say it is. So yeah, I mean, in the medical sphere, it's kind of taking off right now in healthcare to be able to, from the doctor and the patient side of things, to chat GPT, OpenAI, all those things, to where you can ask questions and get responses, right, that are actually pretty good. We've played around with it individually and together, and it's pretty good. So you can ask, anything from, what are the side effects of this medication, to my doctor said this, or from a doctor, hey, can I have a quick meal plan for a diabetic, and it'll pump it out for you pretty quick. So what is it? That is a great question. I don't know. What do you think it is?
Well, it's funny because, a lot of patients, they Google stuff and they bring it to me, and they're like, okay, I found this, but I'm not really sure about the source. Or, sometimes I Google stuff because I need to find out a referral, or I need to get some information, or I go to my favorite, my resources. But one thing that I'm finding with AI, it's pulling from such a large body of information, and it's being able to synthesize it and being able to put it into a format for very specific questions. And you mentioned Chat GPT. For those, it's an open AI. At least it was initially, but now I think it's like 49% owned by Microsoft. But it's only been around for a couple months, I think. But it's one of the fastest growing apps because it's incorporating AI and putting together very personalized questions, and I think are very applicable to our medical practices.
Yeah, absolutely. I find it great personally, just for efficiency, and seeing like, hey, I just need a quick, like we were saying earlier, a quick blast email about a given topic, or a blog post or something like that. I have heard rumors that Google has started to figure out how to penalize if you use Chat GPT for your marketing materials. I don't have any data to support that yet, but for mass emails and texts and stuff, for hey, here's common cold things that you can remedies at home, I think it's great. It saved a ton of time, which efficiency is part of the issue in the American healthcare system. It's just a slow turning wheel, and if we can find areas to be more efficient, is a win-win all around.
Yeah. Well, I guess maybe what we could do is let's zoom out and talk about AI in healthcare. How is AI currently being used in healthcare?
Oh my goodness. I don't know if I'm the right person to ask about that. It is. I mean, from what I've heard and what I've seen, I mean, it's being used for in conjunction with, what's the opposite of artificial intelligence, right? Human intelligence. To, in the OR, in orthopedic surgeries, they use computers and robots and everything to help dial in the surgeries even better, for better outcomes. Or in primary care. Trying to, again, grease the efficiency wheels, if you will, things like that. I don't know. What have you seen in AI in healthcare?
Yeah. So this is something that I'm seeing more with my colleagues, like with the radiologists,
Yeah.
that they're using artificial intelligence to help them locate abnormalities. I don't know. I could never be a radiologist, because sitting in a dark room, going through thousands of images,
Yeah.
I'd get really sleepy. I'd probably need a little more coffee, I think, to
No doubt.
do that.
Yeah.
But I think one thing that AI can do is that it can identify some abnormalities and maybe not necessarily put the diagnosis on them, but they are bringing it to the attention of the radiologist, saying, highlighting them, or putting the red flags and saying, hey, pay attention here, so that they're less likely to miss those. And I know that they're pretty darn good at finding lung masses and CT scans, MRIs, stroke. It's being used. I was reading an article that was saying that using AI for CT scans for stroke they were able to identify an abnormality more quickly. So they were able to start the treatments more rapidly, which is good for the patients. Mm-hmm.
Yeah, absolutely. So basically what I'm hearing is that it can maybe not diagnose, but it can raise an alert of saying, hey, focus on this. Because if you are in that dark room as a radiologist or something for a long time, you might have a glazed look. No hard feelings toward a radiologist. Again, I couldn't do it either. But a long day of surgery in the OR for the orthopedist, or dermatology is another one that there's great apps for, if a patient says they come in all the time to your clinic, we're like, hey, what about this spot on my arm or my face? You can take a picture of it. And then you track it and trend it over time. The more data, the better, right, for these systems. And then you can the system will say, hey, this is growing by this percentage, even though to your own eyes it doesn't look like it's growing that much. But hey, yeah, it might as well be worth taking it off sooner. So maybe skin cancer as well. But anyway, what I'm hearing is earlier detection, earlier treatment, earlier decision making, which comes with it's a double-edged sword sometimes, but it sounds like it could be game changing for many, many different specialties.
Right. And I think our colleagues that are nurses in the ICU are finding some benefit, because AI is helping the cardiac monitors be more accurate in their alerts. I know when I was a resident and I was in the ICU and working in the hospital, those cardiac monitors were going off all the time because of an arrhythmia, or there was a period of time where the heart stopped beating, or that was the perception. But AI is able to help. They go and they use hundreds, thousands of previous monitors to be able to take a look at the individual monitor that's going on, to say, yes, this is truly atrial fibrillation, or this truly is a pause that's worth taking a look at and alerting. And so it's cutting down. I think it was saying it cuts down on the false positive alerts by like 74%, which if I was an ICU nurse, I'd be really grateful.
Yeah, no kidding. Me too. That's actually so basically it's taking the guidelines or the rules that are in place in the ICU, and then adapting them to that specific patient in front of you. That's cool. One thing on the primary care and the direct primary care space, I mean, direct primary care, as you well know, we're both in Colorado actually, which is interesting. That is totally by happenstance, but it's snowing a ton today, and now it's like freezing. But anyway, so when you said San Diego, I was excited to go to San Diego. I wish it was this week. Anyway, in the direct primary care space and primary care in general, there's the Dragon Nuance software is very well known, and that's inpatient as well. That's not unique to primary care, but a lot of docs use it to dictate their notes. Right? It's it's kind of the name brand, if you will. And this is not a plug for them, but they do have they're rolling out this software, the Dragon Nuance Ambient Experience, the DAX. They dropped the N for some reason. And it's basically, you start the microphone, it sits there as you're having your talk, right, with your patient. And then it can pick out the history. It can pick out physical exam as you're talking through it while you're performing your physical exam. And then the assessment and plan as well, which I've seen it only once, like in person. It was fascinating, because I don't know how your style of doctoring is, but mine is kind of just like have a casual conversation with the patient. It's not as regimented as the documentation needs to be for insurance companies. And so having it be able to pick out, okay, that was an important piece of information, I'm going to put that in my note, and things like that was absolutely fascinating. So I think that is another way, kind of zooming in a little bit since we just zoomed out, of like in the direct primary care space, having this just a little microphone sitting there and being able to type a note for us. That is going to be revolutionary, right? I mean, that's going to be a whole nother world, and even in the fee-for-service space, to cut down on those hours and hours of documentation for primary care. And then that's like burnout less. I think this is the official, I'm looking at it right now, the official numbers from the Nuance team said primary care physicians who used the DAX had a 50% decrease in documentation time, 70% reduction in feelings of burnout, and patients, 83%, said their physician is more personal and conversational, aka you can look at your patient, you don't have to look at your screen, right? Which is like, why is that game changing? But it is. So we just had a question from Will. I think Will's in Phoenix, if I'm not mistaken. Hey Will, how are you? How can we get AI to save us and our healthcare teams to save 1,000 clicks a day? I think that's the Dragon Nuance type of thing, but also like you were saying earlier, Dr. Cameron, of blast emails, blog posts, things like that. I don't know. What do you think?
Yeah, I think this is going to be things on the wish list. And I would love to have my virtual scribe. So I know a lot of the emergency room docs, they've got their scribe. They don't type anything into the computer. They see patients and someone else is typing in all the notes and putting the orders in for them. I can't wait until we've got AI that's listening into a conversation. Maybe I don't know. I'm a little worried about privacy, but
it actually deletes the Dragon one. They delete it after you sign your note. Everything's deleted.
Great. Okay. Yeah. So that they can be able to compose the note, put data in structured data so that we can run reports on it, and to be able to put the orders in so you don't have to do those 1,000 clicks I hate the 1,000 clicks. It drives me nuts. That's why that's the part that I least like about healthcare. And like you said, I want to spend my time looking at my patient. I don't want to be in here typing on the computer and not paying attention to my patient.
Yeah, absolutely. And patients, I mean, I had a patient the other day, they threw in a radiology report into the chat GPT, and we did this as well. I did it beforehand because I just wanted to see how it was. And it was fascinating. They just copied and pasted what the whole radiologist said, which they say in their way, which is great. And then it pumped it out in layman's terms and said, this is what this means, this is what this means. And it was very readable. So, I mean, from a doctor and patient side, because sometimes we get a report, and you're like, I don't know, this is a lot of big words, even for a doctor,
Right.
And so plugging it in just to make it more readable is fantastic. So thank you, Will. Great question.
And he actually mentioned another thing about, hey, is there a way, if there is an evidence-based recommendation, that automatically takes you to the orders to get that ordered? I actually think that one of the things AI is going to help us the most, this is more wish list at this point, is in regards to clinical decision making. And so for a specific patient, if they've got diabetes with nephropathy and they've got congestive heart failure, what are the things that patient is going to need? Currently, the decision support helps a little bit, but oftentimes it's not as personalized as we would like. And to be able to put together a specific plan that's tailored for that patient, and not just a colon cancer screening is recommended at age 45 for all comers. So I think that is what I'm really looking forward to, and having it be real time. So as we're getting that nuance documentation that's taking place, a pop-up might say, hey, this person would benefit from getting this test or getting this screen.
Yeah, I've seen it not nearly to that level in kind of urgent care settings where you put the diagnosis in. This is after all the documentation. Put the diagnosis in, and then just has this decision tree of typically someone with this, they need a chest X-ray, they need an antibiotic, things like that. So you just like click down through. But it would be I think, yeah, it's only a matter of when, right? Of what you're saying that it's going to be all integrated. So I did have one question from Mr. Ben. He said, how does the AI and advancements in this type of technology make communication between providers and patients more streamlined? What do you think about that? How will it help us communicate with our patients either better, worse, differently? What do you think?
Yeah, I think there's quite a few questions here about Chat GPT and other AI tools. I think this is going to be something that I think will be really helpful. I put together I've been playing around with Chat GPT recently, and Chat GPT I think is going to have quite a few areas where it'll be applicable. I'm going to share my screen instead of doing it real time. I did a few searches and then saw what it came up with, and I will just share a couple different things.
Yeah.
I think this could be interesting for some of you. Let me share my screen, entire screen. And are you able to see my screen?
Yep.
Okay, so I put in develop a diet plan for someone who is diabetic, lactose intolerant, and is gluten sensitive or has celiac disease. And so this is what it came up with. So this is a very specific question. So it gives a little bit of a preamble. And then here it says, here's some things for breakfast. Here's a snack. Lunch, here's a snack. Here's some dinner, grilled salmon, quinoa, sweet potato, a portion of fruit salad, and a snack. And then they also will say, remember to consult a healthcare provider or a registered dietitian. I think this could be particularly helpful. As in direct primary care, we're not nutritionists. I've not had much training in nutrition, but if I can get some help, I really appreciate it. Here's something that I think also patients might do is they might say, hey, I've got 2 days of cough, fever, body aches, sore throat, nausea, and diarrhea. What's my diagnosis? This is, I don't know, maybe this is going to make us obsolete, Brad.
Yeah.
But I'm glad that there's a disclaimer here. It's difficult to make a diagnosis based on these symptoms, but it says maybe it's a cold, maybe it's the flu, or maybe it's COVID. I put this thinking that COVID or flu would be the most likely diagnosis. But here it refers you back to your healthcare provider. So just some thoughts. What are your thoughts on that, Brad?
Well, my first thought was the first question you asked, can it also prepare the meals for me and like do my shopping?
That'd be nice.
That'd be great. I mean, that would be revolutionary and game changing. All of a sudden the meal is just there on your table because you asked an AI. But I think we're a few more, months away from that happening. I think it is. Everyone Googles symptoms, right? That's just what it is nowadays. Hey, I have this cough for this long. What could it be? And then Google spits out a whole bunch of things that usually either freak people out so they come in to see us, or it doesn't give them a good enough answer so they come in to see us anyway. And so I think it puts it in a readable way and says, hey, could be this, could be that, but you should still talk to your doctor, which I appreciate because Dr. Google is great, but Dr. Cameron is even better. I think it'll get there. And decision making, I think the time thing that you brought up earlier, but even in the ER, when the scribe is typing in, it can help with when the doctor is seeing 15 patients an hour and managing all those things. It can help with shorten the time to decisions and the time to orders and everything like that. I think that's where the first low hanging fruit that it'll really take off. So I don't know. It's going to be exciting to see over the future.
I think it can add some efficiencies. So,
yeah.
Potentially it might help us to be able to avoid some unnecessary testing, especially if there's some clinical decision support that might say the probability of one diagnosis is a certain percentage, and then maybe it lists out the differential diagnosis by probability so that we can target our diagnostic testings appropriately. I also think it could help in our practices, or maybe even more in the hospital, with scheduling and matching scheduling up with the nursing staff with the census in the hospital.
Mm-hmm.
So I think there could be some ways. Oh, sorry.
How many times do you get a text? This is outpatient, in the DPC space. How many times do you get a text? Hey, I'd love to schedule an appointment. It's like all the patients know my scheduling link is on my website, but they still text about it. It could just automatically send, hey, yeah, of course, here's the link. It would save me, checking my phone so many times. My wife would love that. But
I also think ChatGPT could help in communications with patients and developing material for a blog. So let's say it's summertime and I want to encourage my patients to use sunscreen. You can type in, what are the benefits of using sunscreen, or sunscreen recommendations, and it'll put together a blog. And then you can take a lot of times the Chat GPT stuff is generic, and you can put in your own flavor, your own style, add your own examples, and then you can send it to your patients that way. And I think it can help give you the nuts and the bolts or the framework for blogs, so that it can help us communicate and send important information to our patients.
Absolutely. Dr. Jeffrey Gold actually just commented. He said he'd love to show the platform that him and another doc were looking at. And they presented at a symposium last week, which Hint was at, using AI and other amazing tools in TPC. I think we just found our next Tech Docs chat.
All right.
Jeff, reach out to Alex. We'll get you on so then we can see that. I think that'd be fantastic. I've actually heard through the grapevine that was a very impressive presentation. So thank you. I'm looking forward to hearing about that from the source, not through the grapevine. But anyway, other questions? Let's see. Do you see any?
I've got this question for you. So we alluded to it a little bit earlier. Do you think AI is going to make physicians obsolete?
No, and I don't really have to think very long about that. I think being a physician, and I'm very biased. I'm a primary care doc, right? I think medicine is, there's a lot more of personal connection in medicine than we give stock to.
Yeah.
And the trust between doctors and patients, again, I'm very biased, so take this with a giant grain of salt. The trust that is between doctor and patient and doctor, as well as that interpersonal side of things, the accountability side of things. Direct primary care is great, to where I can just text a patient, hey, how's the shoulder doing? Or, hey, you said you're going to work out 19 times this week. How's it going? Things like that. I think consumers, because we're all consumers, patients, right? They will, that is what the main piece in my mind that is going to keep doctors being people instead of AI. Sure, we can all Google and we can all AI all the stuff we want, but we still want to talk to a human. It's like whenever you call into anywhere, and there's the phone tree, and all you have to say is just talk to a human, please talk to a human. We all want to, it's just easier that way. And so I think the interpersonal side of it is a giant piece in my mind. But again, I'm a people person. I sit here all day. This is my clinic. There's the couch, and I love talking to people. And so sure, the efficiency is good. Sure, everything's like that with AI. But I think the people are really going to still want a human to bounce their ideas off of. So I don't know. What do you think?
Well, Dr. Gold just said technology should always enhance the doctor-patient relationship, not replace it. And I agree 100%. I think that when people sign up to join a direct primary care, they're signing up for a relationship. They're not signing up for a Chat GPT experience. They will, and I absolutely think that perhaps the technology that's there to help us will make us more efficient. Potentially save the healthcare system some money. I'm a little worried about the physicians that decide not to adopt new technology. I think that they'll potentially fall behind. They may not be as effective in their healthcare. So there might be some casualties with AI. I don't anticipate that there won't be, but I do think that the physicians, the healthcare providers that adopt AI technology, I think it will enhance their ability to provide even better care and to deliver on a better customer experience, better quality care, and cost savings. I think that triple aim will be easier to achieve.
Nice. Like Dr. Gold said, should enhance. So that's a great way to put it. You should trademark that.
Okay.
I won't steal it, I promise, Dr. Gold. Peter Cummings also he reiterated that. That's fantastic. This is a little off topic, but Voltaire, the ancient French philosopher and physician, right? He said it best. He said the art of medicine consists of amusing the patient while nature cures the disease. I chuckle at that because that's so it's like 16th century medicine, but there is a piece of that to where, the tincture of time, we're so responsive in direct primary care that sometimes, someone texts, "Hey, I've had a cough for 4 hours." It's like, okay, we need to let time dictate what is actually going on. I'm not just going to give you an antibiotic after having a cough for 4 hours, So there is a little piece of in direct primary care of, distracting or amusing the patient while the disease either presents itself or nature cures the disease. But hopefully AI can shorten that amount of amusing, right? That time where we can say, okay, now I'm more confident in saying, yes, this is COVID or whatever it is. So,
I love the amusing them and how important it is to keep our patients amused so that they keep paying their monthly fees. But that being said, I've always referred to direct primary care as being a 1950s small town doc with high tech. That's always been how I've tried to explain it to people. And I think you nailed it. I think that what we're trying to do is to continue to provide kind of the highest technologically advanced care, but with that personal relationship of that 1950s doctor that cared about people, and patients were not just a number. So I'm optimistic that AI can make healthcare more personable, more human, and not more impersonal.
Enhance. I love it. Dr. Earl's right. This is great. This is a great talk. Thanks for doing this. This is we should do this more often.
Are we done?
I don't know. I just whatever you want.
Can I ask you one more? I'm curious to hear what you say about this.
Sure.
And this is not. I'm not a lawyer, but do you see liability malpractice issues coming up with the use of AI?
I mean, I'll speak like a lawyer here, right? I'm not, but sure, there will be. I mean, there's always that risk that's out there. You just have to be careful. You have to be careful. There's, don't on the blog posts or on the blast emails, you have to make sure you don't give any definitive medical advice because that's not the means to do that. And then not lean on it for diagnosing because being a diagnostician comes from medical school, not from ChatGPT. So, and residency. So, I'm sure there will be cases that a litigious individual will want to try to exploit, but it just you never want to be the first to prescribe a medicine. You never want to be the last to prescribe a medicine. I think that applies here as well. You never want to be the first to diagnose something on AI, but never want to be the last either. So,
well, I've noticed that there's lots of disclaimers, with ChatGPT. No one wants to say this is what you should do. They always say talk to your healthcare provider, and my sense is that we probably are going to continue to have that be the case where we're going to need to have a physician still put the final stamp of approval. Well, anyways, I think we're done. Thank you so much for attending today. Thank you, Dr. Brad. I really enjoyed the conversation today.
This is great.
And anything else before we close?
I think that's it.
We'll see you in September at the Hint Summit. Look forward to it.
Absolutely. It's going to be a blast. All right. Thanks, team. We'll see you.